This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're standing outside the Vince Lombardi Cancer Clinic. Now there's a new doctor in this office. It's Dr. Muhammed Moid, and he's helping patients deal with treatment of cancer and also working on prevention. Well, thank you for joining us today. We understand you're relatively new to the area, coming from the Rhinelander area. When you're coming to Oshkosh here, what are some of your specialties when you're dealing with cancer?
So I have been taking care of pretty much all kind of cancers as my practice, but mostly I'm interested in taking care of gastrointestinal cancers and head and neck cancers. All kind of blood or what we call in our business as solid tumors, I pretty much have been taking care of everything up till now.
Yeah, now here at Aurora in Oshkosh, it is the Vince Lombardi Cancer Center. You treat all types of cancers.
We treat all type of cancers.
Yes. Now the specialties that you just mentioned, why are you interested in those specific cancers?
Okay. So obviously there's sometimes, there are multiple reasons why you are interested in one. It depends on where you trained and what kind of instructors or teachers you had. And, coming from where I was originally, incidence of this type of gastrointestinal cancers is very high, and it is true also for United States. So that was one of the reasons why I got interested. First of all, it is very common, and second of all, some of these diseases are very challenging. So that's why you tend to get more interested to try to sort out this and see how you can help the patient the most.
Yeah, and of course you see patients with these types of symptoms all the time. If a person is concerned that they might have cancer, what are some of the symptoms we should look for?
Okay, so first of all, when we are talking about gastrointestinal cancer, we are talking about a whole variety of diseases, and this would include cancers of the esophagus, of the stomach, of colon, rectum, liver, pancreas. So obviously, depending on the site of the disease, the symptoms would be different. The most common type of gastrointestinal cancer, which is actually the second most common type of all cancers, all cancer deaths, is colon and rectum. So, and there are about 143,000 cases of colorectal cancer in U.S. every year, and about 100,000 is colon and about 40,000 is rectum. So mainly if you, when we are talking about colorectal cancer as compared to other gastrointestinal cancers, we are talking about, sometimes very vague symptoms like just abdominal pain. Sometimes it could be a change in your appetite, unexplained weight loss. Sometimes it could be abdominal distension. And then you can have more severe symptoms like rectal bleeding or GI bleeding, or even what we call as intestinal obstruction, where there is a difficulty in having a bowel movement. So the symptoms can be pretty, sometimes very vague and sometimes very severe.
Right. Now, if you're experiencing any of those symptoms, or you know somebody that is, it's not necessarily important to contact you immediately. You probably want to go to your primary care physician.
Yeah, because as I said, sometimes if you're having abdominal pain or you just have a change in your appetite, the symptoms might be due to a variety of other reasons. So I don't think that you need to get worried about right away that it is cancer, but it is always good to have this thing checked so that it can be appropriately evaluated and all the necessary tests can be done. And in case if there is something suspicious or something worrisome, then your primary care doctor, I'm sure, will immediately contact us so that we can work together and try to help you with that.
Okay, so you go through your primary care physician. If it is determined that it is cancer, what are some of the treatments that are available to patients?
So first of all, if you are undetermined that you have colorectal cancer, then I'm sure while we are involved, there will be some other physicians which would be involved also, including a surgeon and a gastroenterologist. And what we are trying to do here at Vince Lombardi Cancer Center is trying to develop a multidisciplinary clinic so that all of these different type of specialties would be working together. And that's something that we will hopefully be running later this year or next year. So the treatments can be surgery, depending on the stage of the cancer and depending on, again, what were the findings of surgery, whether you need any chemotherapy or not. If it is rectal cancer, you may need some radiation therapy also. But there's a lot of information which needs to be processed before we can make a final determination about the exact treatment which is needed.
Sure. Now, you seem like a very nice guy, and everyone should want to meet you, but let's figure out a way to meet you without having the actual cancer. What can we do to prevent these types of cancers?
Okay. So first of all, before prevention, as far as colorectal cancer is concerned, the most important thing that I would like to emphasize is screening. And so it is very important that you are screened properly. And if you are screened properly, then we can catch cancer early. Studies have shown that if your cancer is caught while you were not having any symptoms, then your outcome is much better as compared to if you went to a doctor's because you were having some problems like pain or you were having bleeding, then your outcome is worse. And that is because if you are caught early, then you have an early stage cancer. And if you have early stage cancer, you may never see me also. So because surgery may be able to address your cancer completely and you may not need any chemotherapy or radiation therapy. So screening, which is colonoscopy mainly, starting after age of 50, would be very, very important. And that is something which has been talked about, and usually, your primary care doctor will talk to you about that. A lot of people are very reluctant because of the nature of the procedure, but I think it is worthwhile to have that done. And especially if you have family history of colorectal cancer in your family, it is all the more important that that procedure is done on a timely basis.
And this is men and women?
Men and women.
At 50, we should start thinking about that.
Yes. Yeah. There are some special circumstances in which the procedure would need to be done at an earlier age, but I think that that's something which needs to be discussed between the doctor and the patient.
Okay, and esophagus cancer also, when it comes to screening, very important?
Yeah, so esophagus cancer is something which has changed. It is less frequent. It happens in about 17,000 cases a year, but about 15,000 of them unfortunately lead to death. So it is changing in character now. It is what we call as more of adenocarcinoma rather than squamous cell carcinoma. It is now occurring more in elderly patients, more than 60, and it is much more common now associated with gastroesophageal reflux disease, which I'm sure a lot of viewers would be familiar with, and some of them may have that condition. So it is very important that that is closely monitored, symptoms are closely monitored, and then sometimes some of these patients with gastroesophageal reflux disease may need to have regular endoscopies so that they can visually look for any changes and should be able to catch, again, esophageal cancer at an early stage. Again, the outcome is really different if you're caught at early stage. But overall, again, we are struggling with esophageal cancer. Overall, it's a nasty disease. So, but the good thing about an endoscopy is sometimes it can actually catch it pre-cancerous condition. And if you can be caught at a pre-cancerous condition and the procedure can be done at that time, then obviously outcome is going to be much better.
Yeah, so take care of yourself and get those early screenings.
Sure.
And that should help. We appreciate you taking some time with us today.
Thank you.
If you have any questions about cancer, you can always contact your primary care provider, or you can certainly call Aurora Medical Center at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.